Hello, and welcome to Adventures in Neuropathology with your favorite neuropathologist, Andrea Gilbert. Today we are going to continue on our multi-part series of videos covering various topics in neuropathology. This is meant for board prep and board study, so for those of you who are residents in pathology, neurology, neurosurgery, or anybody else who might possibly be taking a test in the future on neuropathology or would just like to learn more about neuropathology, this is the video for you. So this video series is going to be focused on tumors that arise in familial tumor syndromes. And so that's going to be the focus of this series. We will have other series coming out with different focus and different topics of discussion. So be sure to subscribe and you can get those future videos. Okay, let's get started.
So mystery case number 2. The question is, how many abnormal findings can you find in this brain? How many abnormal findings are present in this one slice of brain tissue? Okay, and so I'm going to give you a little plug here. So I just published a book chapter in Dr. Dan Mais's book. And this is my very first book chapter, and this picture is in it. So if you're interested in what a very quick review with a lot of pictures of surgical pathology and what these different things look like, check out this book. All right, that's my little push, but that's my first book chapter. So yay. Okay. So anyways, so the question is, how many abnormal findings can you find in this brain? Okay, so does anybody have any ideas? Any observations? I will tell you that there are several. Okay, so let's take a look. Whenever I go over brain slices with my pathology residents, it's very easy to get kind of overwhelmed with a lot of different findings. So it helps to kind of go through a pathway or a general set of steps when you're looking at these different brain slices. So one of the things that I like to do is I like to go from the outside in, where I'm looking at the cortex first, then the gray-white junction, then the white matter, then the deep gray nuclei, which includes the basal ganglia and the thalamus, and then looking at the ventricles. Okay, so if we follow these steps, let's take a look at the cortex. We can see that there are some areas of the cortex here that look very uniform thickness. They have that typical gray matter look, which is kind of a gray tan. That's why we call it gray matter, because it's gray and tan. And it's a pretty uniform thickness in some areas, pretty uniform thickness. So if we look at this area and we look at this area, we can see that there's a pretty typical looking cortex. But if we follow this around, we can see that there's some areas where the cortex, that gray matter gets lost. Okay, and we no longer see that gray matter cortex anymore. So this area, like right here, and then also this area up here where we see the gray matter, and it just kind of goes away, and it's replaced by this white looking tissue that looks very similar to the white matter. And the reason for that is that this is a very disorganized region of brain tissue. So instead of having those really compact rows of neurons, instead of having those, we have this kind of jumbled up mismatch of neurons. And what that looks like grossly on the macroscopic naked eye, it looks like it's not as gray as the rest of the gray matter. It looks like it's white, more like the white matter. And that's because we don't have that nice compact nature of the neurons. So what these are here, and here, and here, and here, and here, and here, all of these guys where we're seeing these abnormal cortex that no longer have the gray matter, these are cortical tubers. Now I know that the name tuber kind of gives the impression that it's a well circumscribed, like nodular lesion, but these cortical tubers are not like these really well defined nodules. They're more like these kind of expanses of abnormal cortical brain tissue. Okay, and so these guys along our cortex here, 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 These are all cortical tubers. Okay, so there's multiple cortical tubers in this one brain section. What other abnormalities do we see here? Okay, so there are a few things. If we look further inward into this section of brain, we can see that there's this lesion here. Okay, but there's also within the ventricle should have this nice smooth line to it. Okay, but within the ventricle, we can see that there's this little kind of bulbous guy looking here. And then there's this nodular little guy here around the choroid plexus, which is what this kind of bubbly red tissue is here. So these are subependymal nodules here, okay? And do you notice the difference between this lesion here and a little bit down there, this lesion and that lesion? Do you see a difference between those two? Do you see how this one is kind of a white yellow, very homogeneous, very uniform looking cut surface, whereas this one has a little bit of redness to it, a little bit of softness to it. If you get the impression that if you were to stick your finger through it, it would go right through, very soft. This area probably has hemorrhage and necrosis in it, whereas this one does not. So what we're seeing here is a lesion that's under the ependymma that is covering the lining of the ventricles. So the ependymal lining is the lining that covers the ventricles, and just under the ependymma in the subependymal zone, we have these nodules. So sometimes the nodules, they're very benign and they're small and they just kind of line up along the surface. We call these subependymal nodules. But occasionally we'll have these lesions that arise underneath the ependymma in these subependymal regions, and these are astrocytomas. Okay, so astrocytomas in the subependymal regions. When we look at these under the microscope, we can see that they have these kind of like almost like a small giant cell, which kind of sounds weird, but these kind of larger, almost kind of like balloon cell look to them. So subependymal giant cell astrocytoma, that's what this guy is here, that has a little bit of hemorrhage, maybe a little bit of necrosis, whereas these subependymal nodules here are more kind of benign looking, more homogeneous, more uniform, and that sort of thing. This is the first question that we asked for this case was how many abnormal findings could we find? The next question that we have for this is what is the most likely hereditary tumor syndrome that this patient has? So what did we talk about? So we talked about subependymal nodules, cortical tubers, and sagas. Those are classic findings of tuberous sclerosis. And so tuberous sclerosis is a hereditary tumor syndrome complex that's associated with gene alterations in TSC1 and TSC2. And the way that I remember which protein is associated with which is Hamartin comes first in the alphabet and tuberin comes second in the alphabet, and that's the way that I remember it. There's a lot of outside of these CNS findings that you can see in tuberous sclerosis. Inside the CNS, it's mainly cortical tubers, subcortical tubers, and also sagas. The thing that is going to kill the patient, though, as far as the CNS tumors go, are the subependymal giant cell astrocytoma. It's an astrocytoma, right? It usually is not too bad, but it's still an astrocytoma. So you can go through and you can memorize all of this. I personally don't like to memorize things. So if you could just remember this this mnemonic here, I find this to be very helpful. So when you think about tuberous sclerosis, you want to think about hamartomas, and that stands for hamartoma for H. Angiomyolipomas or AMLs of the kidney. I call them AMLs, but I try not to do that because then that gets confused with the leukemias. Lymphangioliomyomatosis of the lung is very interesting. You get these little nodules within the lungs. And then the other thing, you can go through this, but the other thing is that the major treatment for these patients are the mTOR inhibitors. So this is a handy little mnemonic that you can use to remember the major features of tuberous sclerosis. Obviously, keeping in mind that there's a lot of other findings that you can see. Okay, so that's it for tuberous sclerosis. If anybody has any questions, feel free to ask away. Otherwise, we're going to go on to our next mystery case. Okay.
If you liked that video and you feel like you might have learned something, please feel free to check us out on our website at Adventures in Neuropathology. You can also find us on Facebook, Twitter, Instagram, and YouTube. Okay, I'll see you on our next adventure.